don't know how far back to go. I guess I would say that I'd kind of had problems with sort of anxiety and low mood from being in school.
I went to the doctors, I don't know if that counts, but like I went to the doctors when I was like, I think it was like 13 or something, maybe 12. They said you have to get referred to CAMS, they'll help you. Then my mum tried to get us referred to CAMS, but like that didn't work. And then the teacher referred us, which I think that's what got their attention, because it was a teacher, not like my parents.
For Liam's whole life, he suffered from ADHD, mild Tourette's, he was in special needs schools, he was bullied a lot as a kid, spoke a lot about taking his own life a lot.
He would scream to the point that he would hold his breath and he would go blue, he would knock himself out. I was very, very depressed.
Well, the first time I got referred from a consultant at the hospital, which I seen for another condition I have, and they thought I might have an eating disorder, so they referred me on to SIPS. That took over a year to actually get seen, and then once I did get seen, I was in a very different place to what I first was, and I was very depressed and had a lot of other issues going on, but I was telling them that I was suicidal and I still didn't meet the criteria. So then I got pushed off the list and they said that they couldn't like help me anymore.
I knew that there was something wrong maybe months beforehand, but it got too far and I got too swallowed up in the psychosis, so I wasn't capable of getting help at that point. So I actually needed, I got assistance from my family to get help and was taken to the GP.
Well, they weren't really helpful. They just told us what like anxiety was. Said the worst case scenario is that I could like to start like panicking, and when I do, she says to like to stop basically, which is stupid because how do you just stop? Well, the fact that it wasn't helpful, like all she did, like she spent like 2 or 3 weeks explaining what anxiety was.
Back then it was called legal highs. You could buy them out the shops. There was no law against it then, and he was using that, and it was worse than illegal drugs.
So by the time he was in, I think it was year 5, year 6, he really, really struggled with bullying. So he went to CAMS for counselling, and the CAMS session were very much focused on his relationship that he had with his dad, because at this point we had broke up. So I think he had about 6 counselling sessions, and then that was it. It was left.
I think I was 13. If that was me and a child was in help, and I know what kind of state I was in then, and the way I was like acting and the way I was feeling, I should have got more help than I was even offered.
I got help from the early intervention and psychosis team. So they, a CPN, a nurse and also a psychiatrist came out. I was staying, luckily I had supportive family, so I was staying with my family, and they came out to my family's home to do an assessment. All they just said, it was just thoughts. Like I know that the thoughts. I feel like she could have like said what like I could do, rather just saying it was thoughts, or if I need to be referred to something else, someone else to have a conversation with and like see what is actually like wrong, or like maybe like medication or something to control it.
2019 he was suffering from psychosis, and the psychosis got so bad he took a mattress up into the loft and he wanted to live in the loft.
That weekend, my son started taking fits. His arms went up in the air. He was standing up. He was frothing at the mouth. So I phoned an ambulance. They took him to the hospital. The paediatrician that was on shift that day said he's just a teenager, he's just having a bad time. Really, your body goes into that sort of reaction because you've had a bad day.
You get told to go this way and then they tell you to go another way. It's constant doors shut in your face all the time.
They never mentioned psychosis to me. They never sort of explained particularly why or what had happened.
I feel like I couldn't explain to them properly because they would tell my parents, which I didn't want them knowing. Because I feel like it would be harsher on them than it is me.
I remember them saying at the time, you're gonna feel low after this. You're kind of high now and you're gonna feel low afterwards. And I just remember my little fighting spirit was like, no, I am not. and I didn't go low.
So because I took him out of mainstream school, that's really when the council and the NHS got involved with us, because I had almost rebelled and said, you're not listening to us, then you can't protect him. I'm just going to remove him from your school.
The fortnight leading up to his death, obviously I work in health and social care, I had a lot of contacts, couldn't get any help from nowhere. Crisis team were like, sorry, he doesn't fit the criteria, we can't help you. We'll pass you on to drug and alcohol. Because he'd went cold turkey, didn't get any help. Drug and alcohol were like, well, you've stopped the drugs. We can't help you.
It was just like, what can we do? And they were like, oh, we need to go and talk to this person. And then you spoke to that person and they were like, oh, we can't do anything to help. And it was just constant things like that, which obviously led to me needing to go and see private things, which is cost that my mum could do without spending.
So he's passed on to talking therapies. They were like, well, you've got a history of drugs, you need to go back to... So I was passed from pillar to post for nearly a fortnight, and I was trying to tell the crisis team, they'd come out multiple times, I had multiple ambulances come out of the house to take him to hospital. Every time we went to hospital, the crisis team would turn up 5 hours later to talk to us. And this was on multiple times.
So by this time, he was self-harming, he was cutting himself, he was very isolated, very withdrawn, he was 14. He had a caseworker who come out every 3 months, and he only used to come out when I would phone and say, look, things have gone really downhill, he's in crisis. So he would come out and tell me that he was giving him CBT therapy and that he would come out and review him again. But I would never hear from him, not until I phoned.
And then a couple of years ago, I started to feel really unwell, started to have kind of slight paranoid, delusional thinking, and just was feeling a bit of burnout from work. Things was getting a bit too much for me. And then I kind of got to a point where I realised that things had gone quite wrong. So I tried to get some help.
And they would just go, here's a leaflet, get yourself into recovery colleges and get yourself to a recovery place and do some courses, just keep busy. Which was, in my eyes, it was pathetic, absolutely horrible treatment.
Took a long while to try and find the crisis number, because obviously there's different areas. And once I managed to find that, I gave them a ring, but I was really struggling and it was really difficult. I didn't know really what to say when I rang up, and they kind of pointedly asked me, well, what do you want us to help you with? But by that point, I was kind of struggling with this malfunctioning brain, and I didn't know what I wanted help with. And the only thing that I could think of to say was, well, I think I could do with some time off work, which sounds quite funny now. But it was just, the only thing that kind of came to my mind. And I think the person on the other end of the phone thought I was kind of pulling their leg a bit. and basically said that that wasn't the service that they provided, and that was that.
I just felt like that, like she didn't like help. Like, I can't describe it. It's I feel like she felt like she couldn't help, because I don't think they can.
It would have been better if they had been a bit more curious about what was wrong, or were a bit more warmer, and then I might have been able to open up a bit about what was happening. But it kind of felt like they almost didn't really want to help you, and you had to say the right things to get support. But the way that I was feeling, and the way that my brain was functioning, I wasn't in the right place to say the right things.
One day I phoned them and I was told by I don't know if she was the receptionist or she was a health worker, that it's those that shout the loudest. Now, as a parent who's struggling, who is managing everything, to be told it's those that shout the loudest to get help. What's that? Who even does that to someone? You know, I'm not an argumentative person, and I am patient and I am very kind. I'm not that person to shout. That service should have been provided, and there should have been someone there, and there should have been someone held accountable.
We were getting the crisis team out to our home, and they were trying to tell me I was wrong. I was not listened to. They knew what they wanted to see before they even seen my son. They knew what to see and what the diagnosis was before they'd even seen him. Over the phone they were trying to tell us that it was not drug-induced psychosis. And I was like, look, he's just stopped everything dead. This is drug-induced psychosis. He's hearing voices. I've had to bungee cord all of my exits of my home and my windows because he thinks people are coming in to get him. Paranoid schizophrenia is kicking in. I wanted him to be sectioned. I begged for him to be sectioned so he could be analysed and observed over 24 hours and given the correct medication for a chemical imbalance in his brain. I know what needed to be done, and it wasn't done.
And I know it's difficult because you have to be able to communicate what you need, but that is part of mental health, that actually that communication becomes really difficult. And if the team who are meant to support people in a crisis don't have that understanding, then it makes it very difficult to access support when you really need it.
Because I have been with SIPs, I'm like on register with them now, I don't see them. But that only happened because after I got like rejected from the service, I actually took an overdose a few months later. So obviously then I met that criteria. So then I got stuck on another waiting list, which was supposed to be like a urgent list, and that still took over 3 months to go and see someone.
Initially, I was just a bit devastated because I thought, oh, I've tried to get help and I can't do it, and I don't know what to do now. So then I spoke to my sister, and I don't know what I said to her, but she drove down immediately to my house and rang the crisis team for me. And even for her, it was a little bit of a struggle to get some help, because I remember the lady having a conversation with her and basically said, oh, she probably just needs to get some sleep. So it took my sister to kind of strongly advocate for me to get someone to come out and see me.
And then I seen my first worker, and she was absolutely awful. She would laugh at everything that I said. She didn't have a clue what she was doing. If I asked her a question, she would be like, oh, well, I don't know. I was like, okay. So I walked out of her session, so I waited to get another one, and that was just more waiting. It's just all waiting.
Like, maybe like tell us what I can do instead of just the usual breathing, the go outside, have a cup of tea. Because to tell everyone that, like, that doesn't like solve everything. It's always the cup of tea. Try I mean, like medication, because I know that it like isn't always helpful. But like maybe because it does help with like certain things that I'm underage. You're not 18.
Even though they would come out and speak to him, Liam was a yes man. He would tell you what you wanted to hear. They would say to Liam, "Are you going to hurt yourself, Liam?" No. "Are you going to hurt anybody around you?" No. Within minutes of them leaving, he wanted to kill us. Put it this way, I've got a 4-bedroom home with a lot of doors. He went through at least 6 of them doors with a hammer.
One day I got up and he was just sitting in the sitting room and there was nothing there. He didn't even have the energy to speak. He had been discharged from SIPS and should have been transferred into the adult mental health service. I phoned the adult mental health service before he was discharged and they said not to worry, he'll be transferred over, so 6 months before his 18th birthday we'll get everything in place. Still to this day I haven't heard from him.
I was just on the verge of phoning the police and there was a knock at the door. And it was the British Transport Police. And they said, "Sorry to give you bad news, but we found your son dead on the tracks."
So at that point, when he reached crisis at 19, I phoned the crisis team. The crisis team come out, done an assessment on him there and then, and prescribed metronidazepine, an antidepressant, and that really pulled him round, which I believe that he should have been given some sort of medication. I should have been listened to through SIPS when I was telling him that how bad things were, that he wasn't sleeping. I was almost battling with the consultant. I'm the one that knows my son, right? He's not textbook. He's not someone that you've read about. I know when my son needed help and I wasn't listened to.
I understand how it can seem quite difficult to engage someone in their care when they have a mental health problem. Say, like for me, when I had the hypomania, it felt pretty awful not to be kind of told things as they were doing the assessment. First of all, they didn't actually take me into a private location to do my assessment. And that meant that there was family members who were around at the time who listened in to the assessment. And because I was hypomanic, I couldn't filter what I was saying. So there's a lot of information that I said that I would have preferred to get private, but wasn't given the option to do that.
Well, it was 4 weeks after his death. No communication with any of them services whatsoever that he passed away. And he didn't have a phone, so he used my number. I got a phone call. "Hi Liam, it's Talking Therapies here." Well, I just lost my son 3 weeks ago due to the fact he couldn't get any help from anywhere.
So then following that, I took him to Talking Therapies, who done an assessment with him and said he's too complex for us. He'll be better in the community treatment team. So I spoke with the community treatment team and they told us that he wouldn't be suited to their team. He's not like that. He's not like what? So what is he like and who is there to help?
So I rang my the psychiatrist who'd done the initial assessment, and we had a little bit of a head-to-head. It kind of, she was obviously very pro-medication because that's what all the guidelines say, and that is the only really main course of treatment for bipolar. But I guess for me, because I'd already experienced psychosis and a florid psychosis that was a much more severe event than my current what they labelled hypomanic episode, I knew myself that it was possible to get through it without the medication, and I just knew that the medication was making me feel so much worse. For me, it was just logical that I would come off it.
Some people are so reliant on the drugs and alcohol. They shouldn't be segregated because they're using drugs and alcohol from mental health treatment, because they're self-medicating for a reason. And 99% of the time, it's due to childhood trauma. And that's why they started using drugs and alcohol at an early age, because they're trying to mask the traumatic things that have happened to them when they're young. And then that obviously develops into full-blown addiction later on in life. I think they should try and find a way to treat people's mental health while they're in active addiction.
So I kind of had to strongly advocate for myself to come off the medication. My psychiatrist did recommend a different medication, but I don't know, I just felt like she wasn't really able to listen to my arguments, or it was more like she was fighting her corner for what she wanted for me, which I do understand, because obviously they have to follow guidelines. But it didn't really help me, because for me, I'd made my decision, and I would have found it more helpful if at that point she would have discussed how to safely kind of wean off the medication. In the end, I just had to work that one out for myself.
I couldn't do it anymore. I was just numb. I was just so exhausted. I went home, I wrote a letter, and unfortunately it was Joe that found it. And I went out the house that night and I cut my wrists. I just didn't want to be here anymore. I didn't want to handle this on my own. No one was listening to us. The amount of health professionals that I've told over the years, I can't do this, I'm on my own. Not one of them actually at the time asked us, how are you coping?
Or even just as simple as when you go and see someone, actually feel like they're listening and taking into account of how you're feeling and making you like feel like that's okay. It just feels like they're trying to get you out of the room just quick as possible.
Actually showing some empathy towards them, empathy towards people, and making people feel like they're not alone. Having something there in place.
I hate how they treat people. Like, people come to them with like problems, and they don't really I don't think they listen properly. Like, they just think that they know what is wrong with you, and they just tell you things.
I think there should be work in schools and stuff like that to actually talk about mental health and things to do to help, but actual things that help. Because you're still like hearing tips now, just like have a cup of tea, go for a walk, have a bath, and it doesn't help.
My main point is NHS should actually listen to their clients, listen to the service users, and try and understand where they're coming from.
Probably just not listening to how much people are actually struggling. Like, I'm sitting there telling you that I feel like I want to kill myself, and you're still not bothered enough to actually get me help. Like, that's the worst thing. If a child's sitting there saying they feel like that and you're not willing to even give them help, or if you can't tell them exactly where else to go, where they're going to get help, that's just not right.
NHS services are failing because of lack of funding, lack of training, lack of empathy, lack of understanding, where the third-party sector services are thriving because they employ people with lived experience, like myself. You can't be taught lived experience.
I feel like if you talk to other people who have depression or something, you could it's better than talking to any doctors.
I think it's just the fact that you can say anything you like and you can talk about anything, and it's just someone there who will listen and who will acknowledge how you're feeling and not make you feel like daft for it.
I think definitely that kind of things like peer support, online peer support or face-to-face definitely helped me it felt like it helped me a lot more than, say, the traditional medical approach. And actually having someone who understands where you're coming from and kind of just offers a listening ear is sometimes a lot more helpful than someone who's just making sure that you're not going to kill yourself and here's some medication.